Hi everyone, these are the important questions. Do I need to go for chemotherapy? How many sessions of chemotherapy do I need? What about immunotherapy? What about surgery? What about CT scans? Well, join us on our Simply Healed program every Thursday nights at 7:30 p.m. Singapore, Hong Kong, and Philippine time. Our sessions are interactive, featuring a live Q&A with experts and doctors who will answer your questions in real time. You can type in your questions and get immediate, personalized responses. This is your chance to take control of your health. So take advantage of this informative and supportive experience. Visit our Facebook page and message us on Messenger to find out more. See you there this Thursday.
One reason why I recommended initially PPARS is because it can induce lung cancer cell death. The main reason why I tried PPARS liquid, and it did well for the patient. It helped with the tumors. The enlarged abdominopelvic lymph nodes were not detected. This was gone. So that was something that I was actually quite surprised. A 12-centimeter tumor disappearing.
Everybody turn to your neighbor and say, do more. Right? Don't just think there is no one product that will cure you of cancer. Okay, that is like it's like a scammer trying to sell you something. All right, it is a comprehensive approach. When you need surgery, do the surgery. Or prepare for the surgery so that you recover well, right? And then if you need to do chemotherapy, radiation therapy, do it. So this is where PPARS really comes in. It's a gene activator, so it's a signaling pathway. It switches on your pathways, your systems. Then the other nourishment that you take will be properly used. Is it easy to understand now?
Now let's not keep you waiting. We are now officially opening the AMA or Ask Me Anything portion.
So she has to take maybe just the capsule or the powder just to regulate blood sugar. And then undergo the surgery, and after the surgery, to aid in wound healing also and for recovery, she can continue the capsule.
I can safely say this, all LJ products are great. But if you have acute illnesses like cancer, then we are a world of a difference. Because if you want chlorella, take chlorella. Diba? If you want spirulina, take spirulina. When you take Simply Nature PPARS, you're taking our microalgae for its PPAR agonist.
We are always with you from start to finish.
Yung sister ko had the symptoms of diabetes. Siguro 10 years na. Madalas siyang umiihi, tapos laging pagod, pumayat, mataas ang BP. Tapos siyempre, mga non-healing wound.
Yung sa paa po ni ma'am, paano po yun nag-start?
Okay. Kasi gito yun eh. Yung first na hospital niya, not because of diabetes. Ang una niya, pneumonia. Ayan. Doon nalaman na may diabetes din siya, by accident. Right foot niya, may para siyang matang isda lang. Maliit na itim lang. Tapos napapaligiran lang siya ng parang dilaw na kulay na dilaw. Ring sa sugat na yun sa center. Tapos tinanong ko, bakit? Hindi niya daw alam anong reason. So sigurado ko dahil nga may background ako sa medical, siguro dahil yun ay lumala na yung taas ng sugar niya, hindi niya na monitor, hindi niya nabibigyan ng gamot, nagkaroon siguro siya ng komplikasyon. Yung nerve sa paa na damage na. So, hindi niya na nararamdaman na may natapakan pala siya. So, probably, yun siguro yung nangyari. May natapakan siya, nasugat yung paa niya, maliit lang, tapos hindi niya naramdaman. Lumala. So, nagkaroon siya ng lagnat on and off, nakahiga lang siya. So, sabi ko sa kanya, so, anong plano mo? Sabi ko, pa-check na natin yan. So, pina-check namin as OPD. Chinek, binigyan, niresetahan ng gamot, tapos tinignan yung sugat, binusbos. Pero kapiranggot lang ang tinignan. Tapos, in-advisean na lang kami, linis, at 7 days na gamutan ng antibiotic. After na 7 days, lumala lalo. Yung pinaka-pamamaga niya, lumaki lalo. So, sabi ko, ay, na-infect na to. Nilala ko sa emergency room. Ayun, doon nalaman lahat. Mababa pala hemoglobin, mataas masyado yung sugar, yung diabetes niya, talagang marami na komplikasyon.
Ano po yung plans ng doktor niya?
Na-refer siya sa ortho. Ang plano sa kanya ay putulin. VKA or the below the knee amputation. Hesitant din kami pumirma ng consent. Then later on, ni-refer naman siya sa plastic surgeon. Nagsabi naman sa amin na maganda pa circulation. Might as well na tulungan na lang natin yung paa, linisin, wound dressing for twice a day, then debridement as needed, religiously. So, yun ginawa namin. Twice a day kami naglilinis, tulungan kami ng husband niya, hanggang ang nangyari, gumanda, pero andun pa rin yung plan na putulin. Hanggang makita na gumaganda na, ayun, hindi na naulit yung plan nila na maputol yung paa.
Kasabay po ba nun may mga tinitake pa siyang gamot?
Bukod doon sa antibiotics, bukod sa mga gamot na binigay ng doktor sa ospital, may tinake din siya na alternative medicine, yung PPARS. May kamahalan. So, sinugal ko para, kasi kailangan kung di mo isusugal yun, baka maputulan talaga. Kasi kahit naglilinis kami ng paa, tapos nagdidibri, pero parang slow yung healing process niya. So, I tried na painumin siya at 10 tablets at AM and 10 at lunch and then 10 at the evening. And the soft gel, twice a day also. So, religiously binibigay ko yun sa kanya. Ang dati kasi, dahil nag-peak yung WBC niya, medyo nag-septic siya. Sa mga nakakaalam, sabihin yung infection kumalat na sa buong katawan. Kaya nagkaroon ng problema yung kaisipan na nawala sa wisyo. Dramatically, yun yung maganda doon. Dramatically, after 1 to 2 days, parang nakita ko siya ng improvement. Doon, nakita namin na sa help ng antibiotic and together with PPARS, sabi ko, maganda yung kinalabasan. So, why not continue? Hanggang nakita ko rin na gumaganda yung healing process. Tapos yung WBC, nag-dramatically from 46. Imagine, 46, dramatically bumaba siya ng 39, 33, 27, 19, 15, and then 11, 9, 7. So, nakikita mo talaga yung changes na nagawa ng gamot na yun. So, yung support ng family ay mahalaga sa recover ng pasyente. So, una, yun yung talaga nakikita ko, yung support system. Then secondly, syempre, with the help of the advanced technology, like yung mga ini-introduce ng mga gamot, hindi ko pwedeng alisin yun sa scene, sa scenario. So, ako kasi, dahil nga nasa medical field ako, medyo alam ko yung mga ganyang mga alternative medicine and evidence-based ako. So, sa PPARS, sabi ko nga, maganda yung result. Ito walang harong biro to. It's not joke. Yung mo ako binayaran So, it's no joke. Talagang maganda yung yung nangyari sa kapatid ko, lalo na yung wound healing. Yun yung nakikita ko yung wound healing talaga. Nag-granulate siya, gumanda yung circulation, nabuo ng laman, nagkalaman yung mga paa niya na dating wala. Makikita niyo naman sa picture, di ba? dating wala, nagkaroon ng laman. So, na-prevent natin yung pagputol. I can say na effective. Okay, effective yung PPARS.
Ano yung ma-advise nyo sa mga patients na same case sa sister ninyo?
Okay. So, I advise them to try. Then, kagaya ko, gusto ko may ebidensya na experience ng on hand ng ate ko. So, ganun din yung papayo ko. Try to experience yung healing, try to take the medicine religiously, ha. Despite medyo may konting kamahalan, but then kung titignan mo naman yung long-term na gamutan, mas mahal yun. Tsaka hospitalization. At yung, syempre, yung recovery. Yun yung maganda doon eh. Yung recovery, mapabilis. So, try ninyo. Hello, I'm Joel Elcano. My sister, diabetic since way back 10 years up to now. Because of Simply Nature, hindi niya na kailangan mag-amputate. Yung recovery niya, yung unti-unti, nagkaroon ng maganda, nagkalaman yung kanyang mga paa. Still recovering, yet nakikita ko yung magandang bunga. And that is because of Simply Nature, PPARS. And I trust Simply Nature.
Assalamualaikum warahmatullahi wabarakatuh. Bismillahirrahmanirrahim. Ako si Haji Norma Yusuf, taga Zamboanga City. Pero dito na ako nakatira sa Maynila. 13 pieces na bukol, pero yung mga iba maliit siya. Pero yung itong isa malaki siya, parang umabot na ata ng 3. Kaya nga ito sabi ng doktor, kailangan tanggalin na. May kaibigan ako, i-try ko daw itong yung PPARS. Pangalawang gabi, may naramdaman ako parang iba. Yung parang may langgam na parang gumagalaw ganyan hanggang dito, hanggang sa talambakan, ganon. Pangatlong araw ko. Parang kung sumakit yung dito ko, parang gusto ko talaga. Pag ko ganyan sa CR, yun parang lumabas talaga na ganyan, napakarami talaga. Siguro sunod-sunod yun, 3 araw, ganun. Tapos sabi ko, pagtapos yung dito ko, minsan yung parang, ganun-ganun ako. Parang masikip dito, parang minsan sumasakit dito ko, ganyan. Yung na ako dito, umabot na ng mga 5 days, ganyan. Parang nawala yung sakit dito, nawala siya. Parang hindi na ako ganun-ganon. Pag nagsalita ako, parang tuloy-tuloy na, wala na akong halos maramdaman. Kaya siguro, hindi ako, sabi ko, parang ayaw ko magpa-opera. Siguro, mayroon talagang gamot para dito. Binigay ng God. Ngayon, hanggang ngayon, parang maganda ang, maganda ang pakiramdam ko. Yung high blood ko, pag parang magandang tinanggal ko na yung sa cholesterol ko, hindi na ako, pero yung sa cholesterol ko, pag tinatanggal ko yon, parang hindi, mga 2 araw, parang masama ang pakiramdam ko. Pero ito, 14 days na, ngayon 14 days na, basta 2 weeks na, hindi ako uminom ng subastatin, wala akong nararamdaman na parang maganda ang Kaya yun, ngayon bumili pa ako ulit ng tablet. Oo. Kasi sabi ko para para lumakas talaga sa akin Kasi nararamdaman ko talaga na maganda. Haji Norma Yusuf, ay bukol ako dito sa liig ko, 13 piraso. Umabot na ng 3 cm. Take ako ng PPARS 2 times, morning at saka gabi. Pag numulok ako, hindi ko na siya mararamdaman. At saka kinakapa ko siya, parang nawawala, parang wala na, hindi ko mahawakan. Hindi katulad ng dati. Salamat, Simply Nature.
My name is Jhen Lim, a licensed pharmacist and one of your health advisors here in Simply Nature. We are an international distributor of food supplements derived from a unique strain of microalgae known as PPARS, which has been tried, tested, and certified, proven to support not only cancer treatment, but also enhance general health and reverse metabolic syndromes like hypertension, diabetes, and high cholesterol. Now, just a quick recap. Last month, we discussed about early detection and advanced treatment strategies for colon cancer recurrence. Now, as we step into this new month of February, I want to check in with you guys. Do you have constant chest pain? How about repeated pneumonia or bronchitis? Do you have extreme shortness of breath, wheezing, or hoarseness, caused by difficulty in swallowing? And finally, are you a smoker? Because these are the signs and symptoms of lung cancer. It is the top 1 cancer among men and top 3 among women. Now, don't be scared. Recent advancements have paved the way for innovative treatments that offer hope for patients. That's why our topic for tonight is led by 2 distinguished experts. First is a seasoned international speaker on a wide range of topics, from personal success to healthcare, who is also the founding director of Simply Nature International. Our PPARS expert, fresh from Singapore, you all know him, it's Mr. Shyan Lim. Good evening, Sir Shyan.
Hi, Jen. Okay, yeah,
There you
I
go.
finally appeared. Hi, Jen. Good evening to everyone. I just came back from Singapore. We celebrated Chinese New Year in Singapore. So glad to be back here in the Philippines with everyone. Tonight's topic is one that's important. As Jen mentioned, this is the #1 cancer, one of the top cancers in Philippines for men. So, and of course, women also can get lung cancer. So I hope you guys learned something, and we'll be here to answer all your questions in the Ask Me Anything segment right after our discussion. So I'll hand the time back to Jen, who will introduce you to our discussion tonight.
Thank you, Sir Shyan. Up next is Dr. Jansen Calalan, a graduate of St. Luke's College of Medicine, a diplomat of the International Board of Lifestyle Medicine and the Philippine College of Lifestyle Medicine. Currently serving as a consultant at renowned institutions, including Alta Integrative Medicine and Wellness Complex of Perpetual Health Medical Center Las Piñas, Tree of Life Wellness Center, Centro Holistico, and Simply Healed Medical Group, where he practices integrative oncology. Let's all watch this.
Hi everyone, this is Dr. Jansen Calalan. I'm a lifestyle medicine physician practicing integrative oncology. Welcome to our webinar. Let's start the discussion. Genetic testing in lung cancer is very important to determine what treatment to use for a patient. No? So I'll give an example. For non-small cell lung cancer, there is a genetic mutation that we call an EGFR mutation. So if this mutation is present in a patient, in a lung cancer patient, then we can use targeted therapies like your tyrosine kinase inhibitors. No? So one example would be erlotinib. If the patient is negative for EGFR, then we have no choice but to use chemotherapy. So this is how important genetic testing is. The difference when it comes to survival rate, no, the difference between chemotherapy and tyrosine kinase inhibitors or targeted therapies is immense. No, the difference is very significant. And when it comes to quality of life, the difference is also very significant. For patients who are EGFR positive mutation, no, using tyrosine kinase inhibitors, they do have side effects. They do develop side effects, but the side effects are milder. They are less compared to cancer patients, lung cancer patients undergoing chemotherapy. PD-L1 inhibitor is a type of immunotherapy wherein these are checkpoint inhibitors, by the way. No, so cancer normally in a normal healthy individual, this individual also has circulating cancer cells. But this individual don't form tumors because this individual's immune system is able to detect the cancer cells and eradicate them. However, for cancer patients like lung cancer patients, no, they form tumors, they go into an advanced stage because the premise is the immune system is not able to detect the cancer anymore. That's why the cancer has spread and spread and spread. No? So we have a molecule or a drug that we can use to remove the cloaking device of cancer cells so that the immune system can detect them again. So this specific molecule are what we call as checkpoint inhibitors or your PDL1 inhibitors. No? So one such molecule is pembrolizumab or Keytruda. And the benefit of this is it removes the cloaking device of cancer cells so that the immune system can detect them again, so that the immune system can eradicate the cancer cells. The difference between small cell and non-small cell lung cancer is just in their pathologic appearance, no? Their appearance under the microscope. When it comes to risk factors, smokers typically develop small cell lung cancer. Small cell lung cancer has a poorer prognosis compared to non-small cell lung cancer. Although smokers can also develop non-small cell. However, for non-smokers, no, for non-smokers, the type of lung cancer that they develop is non-small cell. These two types of lung cancer also differ in their treatment in that for non-small cell lung cancer, we can do genetic testing for EGFR mutation. So if this mutation is present in a non-small cell lung cancer patient, then we can use tyrosine kinase inhibitors. This is what we call as targeted therapy to treat the cancer. Targeted therapies can be given for a very long period of time. Sometimes it can be given for life. When we compare these, the side effects of this molecule, compare them to chemotherapy, the side effects are milder. So comparing the quality of life of patients who are on targeted therapy and who are on chemotherapy, then those who are on targeted therapy typically has a better quality of life. These drugs, no, or these molecules like your tyrosine kinase inhibitors, no, EGFR that inhibits EGFR, they specifically act on an enzyme found in the cancer cell. So when they inhibit this enzyme, then the protein that gets produced that stimulates the cancer cell to multiply would be inhibited. Okay, so this is how these molecules act to stop cancer. Now, during the event that these treatments do not work anymore, then we have to use other treatment modalities already. So typically, we shift to immunotherapy, your pembrolizumab, for example, but the patient has to be tested for PDL1 status. Chemotherapy is almost always on the table. So this is how we decide on the treatment that can be recommended to the patient. Of course, integrative medicine treatment modalities would always still be applicable for the patient in every stage of the treatment. Okay, so PPARS can make conventional treatment for cancer work better in different ways, no? Actually, in 3 different ways. So it can improve sensitivity to chemotherapy. It can reduce resistance to chemotherapy, and it can improve the tumor microenvironment so that the cancer cells die easier. No? So first is how does it improve chemosensitivity or improvement to chemotherapy? So PPAR agonists work in combination with certain chemotherapeutic drugs. They work synergistically so that when you combine these 2 treatments, the effect is not 1 + 1 = 2, but 1 + 1 = 4. Yeah, so it enhances the effect. Okay, it works via different genetic pathways. No, so number 2 is how can it reduce resistance to treatment? PPARS activates pathway that induces cell cycle arrest. It induces cell death or apoptosis. It can reduce inflammation, and it can also inhibit angiogenesis. No, so it basically works on a different pathway than the chemotherapy. So by bypassing these pathways, you can reduce the resistance of cancer cells to chemotherapy. In other words, to make cancer cells more sensitive as well, no, to chemotherapeutic drugs. And lastly, PPARS can affect the tumor microenvironment so that the tumor, the environment around the tumor, the inflammation around it goes down because tumor cells, cancer cells thrive in high inflammatory environment. That's one. Another one would be to improve the immune system's detection on the tumor so that more immune cells can kill cancer cells. And lastly, to reduce side effects of the chemotherapy. So PPARS can protect the bone marrow. By protecting the bone marrow, you would be able to mitigate the decline of the blood cells, no, being produced by the bone marrow, reduce inflammation that is put on the bone marrow. So, in a way, you would be able to make sure the patient's recovery in between chemotherapy cycles would be shorter. This would ensure that the patient's treatment would be on time and delays would be minimized, and most importantly, the treatments would be completed.
We've covered a lot of innovative treatments for lung cancer tonight, and I know you must have some questions. So type them down in the comment section below, and we will try to answer as many as possible because it's time for our much-awaited live AMA or Ask Me Anything portion. And to answer your questions in this modern world filled with noise of different health opinions, trust the ones from the experts. Let me call back on Mr. Shyan and Dr. Jansen. Okay.
Oh, good evening.
Good evening po.
Good evening,
Okay.
everybody. Sorry. Yeah. Doc, 恭喜发财. Happy New Year.
Hi, Happy New Year. Happy Chinese New Year. Hi.
Yeah, for everyone who's watching, those of you in Philippines, you may not know, but Chinese New Year, I think, lasts for 15 days. Not just the 2 that you celebrate over here. Jhen, shall we start?
Yes, I can see lots of questions. Actually, they already started submitting before the webinar started. So first one coming from Ness. What can you recommend if I have aplastic anemia?
Okay, just to give everybody an idea what aplastic anemia is, no? Aplastic anemia is a condition wherein you are not producing blood cells, especially red blood cells. Okay? So, it is very similar to leukemia in that leukemia also will have eventually a deficiency of blood cells because the blood cells are not functioning well. Okay? The difference between this is aplastic anemia is an autoimmune condition. Leukemia is cancer. Okay?
Wow.
So, I don't know with some of our audience if you have watched the movie Cells at Work. Wait, let me double check the name of the movie. Cells at Work.
Is that a cartoon?
Anime?
Yeah. It's Cells at Work. Okay, so Cells at Work is it's based from a manga.
Okay.
Then Japanese turned it into an anime. Okay? Yeah. Then they turned it into a live action movie. So Cells at Work is a movie basically about the human body, how the human body works. But they made it into characters, you know. So you have your red blood cells, white blood cells, you have your platelets, etc. Okay, so in that movie, the patient, okay, the main character, okay, the main character developed leukemia. So leukemia, you have okay, so cancer is an unlimited production of cells, uncontrolled production of cells, right? So that's cancer. But for leukemia, it's a blood cancer. Okay, so what component of the blood is replicating uncontrollably? It's the leukemia cells. Okay, so that's leukemia. So aplastic anemia, the blood cells, the stem cells are getting killed by what? By the white blood cells. So the white blood cells are targeting their teachers. So okay, so that's I think the best way. Yeah, well, I think that would be the best analogy that I can make right now. But you get it. So if you kill the teachers, then the students, okay, the young cells won't be able to mature, won't be able to graduate and specialize. Okay. So in the blood of a patient with aplastic anemia, blood cells are down. So if we just look at conventional medicine, okay, what are the treatments that can a patient with aplastic anemia undergo? That would be mainly eradicating the remaining stem cells, blood cells, immune cells. So it's basically eradicating all the blood cells of the patient. That's actually what they did to the patient at the movie of Cells at Work. Okay, sorry for spoiling, but it's actually showing now at cinemas here in the Philippines. Anyway, so why do we need to eradicate all the blood cells? Because the white blood cells are defective. The white blood cells targeting the stem cells are defective. So you have to eradicate the source of the defect, okay, which is the defective production of the white blood cells. So once you eradicate the blood cells, then you get a bone marrow transplant. Okay, you get a bone marrow transplant from somebody, so you get new blood cells. You get brand new blood cells that gets produced. That's actually the definitive treatment for aplastic anemia. So now, here are, if we consider other kinds of treatment for this, what other kinds of treatment can we consider, especially for these kinds of patients? Well, number one, since this is an autoimmune disease condition, then modulating the immune system is very important. So, one would be PPARS. So, if you use chlorella, that can also help modulate the immune system, reduce the inflammation. Okay. Another one is vitamin C drips that can also help. Other treatments such as let me think. Yeah, vitamin C, PPARS. Actually, those are a few things that we can do right now. Okay. Now, of course, for the meantime, while the patient is waiting for the definitive treatment, some problems that we can encounter, which can be quite dangerous, would be the platelets going down, or the patient suffering from brain damage because of too low of a because of the anemia, severe anemia. So to help the patient, so vitamin C drip, PPARS or chlorella can help. Another one would be hyperbaric oxygen therapy, because hyperbaric oxygen will push oxygen directly to the patient's blood, bypassing the red blood cells. So no matter the state of the anemia, without having to transfuse blood, you can do hyperbaric oxygen to push oxygen to the patient. Yeah. So those are some treatments that we can do. There are others, but we won't be able to entertain other questions if we discuss solely aplastic anemia. Okay.
So as Dr. Jansen said, the two primary things that you can do, that you can buy and take at home regularly, would be vitamin C and Simply Nature PPARS. Doc, for Simply Nature PPARS, what would you recommend from tablets to soft gel to extract?
Now it depends on the severity of the symptoms of the patient, because patients who have aplastic anemia, their the range of the disease is very wide. So some patients can live well normally. They just have to take a few medications to sort of maintain the status quo. Some patients are quite severe already. So If the patient is quite severe clinically, then it would be PPARS liquid, definitely automatic. But if the patient can, is well, patient is able to function, then I would probably choose the tablets and the soft gel. That would be probably enough.
All right, so there you go. For the particular viewer, you have the immediate action that you can take. You can obviously order vitamin C and get it from your local pharmacy. For the Simply Nature PPARS, you drop a message. And the next step you should do is have a consult with Dr. Jansen, all right? Because Dr. Jansen is able to provide the actual in-clinic therapies, right, Doc, as you have mentioned before. So there are two things that you can do right now for the viewer. All right, Jhen, the next question, please.
Yes, so for those of you who wish to have a consult with Dr. Jansen Kalalan, the link to schedule an appointment is in the description box and comment section below. Our caring healthcare specialists, Miss Beth and Miss Irish, will reach out to you shortly. Next question is from Violeta. My father's creatinine is 131. Can he still take PPARS liquid? What is the ceiling creatinine level that can take liquid, PPARS liquid?
Okay, very good question. Now, the reason why we don't just prescribe PPARS liquid left and right for patients who have very high creatinine levels is because PPARS liquid has potassium. It contains potassium. Okay. Now, in patients who have problems with their kidney function, potassium can be a problem. Okay. Because in patients who have CKD, potassium can go up very high. Now, if potassium goes up very high, problem there is it can affect the heart. It can actually cause arrhythmias. It can make your heart stop beating. In other words, you die. Okay? So that's the reservation. However, it doesn't mean that you have kidney failure. PPARS liquid is totally out of the question. It's totally ruled out of the treatment options. No. Ultimately, what will decide whether or not we can give PPARS liquid is the potassium levels. Because there are patients who have creatinine levels of more than, even higher than 131. I have seen 200, 300. They can tolerate PPARS liquid, no problem. Okay? As long as their potassium levels are manageable, are normal. Okay? I have encountered patients, actually, these patients have been taking PPARS liquid even before when I saw them. So there are patients referred to me by Simply Nature, no? So thank you. Patients, CKD patients on PPARS liquid, actually not just one vial, some are even on 3 vials per day. And when I saw them, checked for the potassium, it's normal. Okay, so it's not the creatinine per se. All right. So I hope I answered your question.
I just want to add over here. You do, for everybody's understanding, it's important to note that as Dr. Jansen and I recommend products and protocols and knowledge to you, it is always in a very general form, right? So that is why also for CKD patients, because we don't have your specific data, we don't have your latest blood test in front of us. That's why we would definitely recommend you the protocol that will do you no harm, that has no potential of any contraindications or complications, right? So as Dr. Jansen said, there are patients who are doing very well with CKD, but yet they're doing very well with liquid PPARS. However, if you're not going for a consult, right, then stick with the extract powder and not the liquid. But however, if you want the best of the best, then go for a consult with Dr. Jansen, all right? So that you can clear with him whether your kidney case, you can take the liquid, which is going to be the best protocol that you can have. All right. Jhen.
Thank you, sir. Next question is from Kim. I have thyroid nodules. Is it okay not to eat hours after PPARS powder because I'm on intermittent fasting?
Okay, this is a little bit technical, no? It's okay. It's okay not to eat hours after PPARS powder. It's okay also not to eat before taking PPARS powder. Yeah, so it's fine. Regardless, no, whether or not you ate. If you go for a consult under me, some of my patients, I actually advise them to take PPARS powder after eating or take PPARS powder at the end of their batch of taking their medicine. So it's the last
Why, doc?
take.
Why, doc?
Yeah. It's because after eating, you have your mouth gets full of saliva. So when you take something sublingual, since the saliva is abundant, no, it's very easy to dissolve. However, okay, this is just me. Okay, this is me. Simply Nature, if I remember correctly, they advise patients to take PPARS powder on empty stomach. Yeah. So
Yeah, that is because many patients just swallow the powder. But doc, you are right about one thing though. Like for myself, when I take Simply Nature PPAR extract powder, I find that it can stay under my tongue for half an hour because I don't really salivate that much when I put the powder in my mouth. In fact, I have to take little sips of water to, wet my mouth. So that's a very wonderful and interesting insight that you have. So for those of you who have who wants to take it completely sublingual, but you have problems salivating, Dr. Jansen suggests like taking it after some time after you've eaten. Maybe Doc, did you say half an hour or 1 hour? So your
no specific time. Just take
no specific time.
after you eat. Yeah, once you, get everything that you swallow, last thing to take is the PPARS powder.
Yeah, because it's going to skip your digestive tract anyway, and you get your mouth salivating, so it will dissolve better in your tongue. So that's a good tip even for our long-time users of PPAR powder.
Yeah, I have a question though. I have a question.
Yes.
Why do you advise patients to take PPARS powder on an empty stomach?
Okay. Actually, the same reason why we advise patients to take the tablets on an empty stomach is just, I guess it's a Eastern philosophy that when you take anything that is tonified, for those, so we look at PPAR protocols not from a medicinal point of view. We look at it from a tonifying point of view, which means it actually nourishes the body rather than like the way a drug works, right? Even though we understand the mechanisms of action of PPARS protocols from a Western conventional aspect. So we do still come from that angle. Like you said, actually, it's not much of a difference. Also, Doc, sometimes in Philippines, people drink coffee with their food. Right? People drink coffee. People drink Coca-Cola, Pepsi, and a lot of sugar water. Okay, that's just not something you would naturally take when you take something as precious as PPAR powder. You don't want to mix it with coffee. So that's another reason why we tell people to take it on an empty stomach, because normally they flush their system with a coffee if they eat a meal. Yeah. Thanks for the question.
Okay, before we move on to our next question, let me just quickly greet one of our avid viewers, Miss Naomi Veras from Marikina. Okay, next question from Theodore. Can I drink water immediately after taking PPARS powder?
Then we asked the same question.
Yeah, I think this is similar to the earlier questions, no? So my advice is don't drink water immediately after. Make sure before you drink water, make sure the PPARS powder has dissolved completely, or you have very minimal residues left, no, inside your mouth before you drink water. Okay, so as not to waste the precious PPAR powder.
All right, so all the tips that Dr. Jansen and I are giving is not about the efficacy it's not saying that it will affect the efficacy of the powder, but I guess it's more like the efficiency. How much of it do you absorb into your system? So, okay, for those of you for the viewer who asked this question, I think you have the same problem as me. So once you put the powder in your mouth gets dry. Your mouth gets dry. Okay, so you don't need to drink a lot of water, maybe just a small sip, and then you let it rinse around your tongue so that you can swallow properly. Because, for me, when I put the powder under my tongue, my salivation actually stops. So actually, it means it becomes difficult to swallow, in fact, normally, because there's no saliva lubricating my mouth and throat. So I just take small sips of water, not enough to wash the PPAR powder down my throat, just enough to moisten my mouth and make it easy for me to swallow normally. I hope that helps.
Okay, more questions about Cleansing Plus from Mark. Can I still take Cleansing Plus even if I have a colostomy bag?
Oh,
Yeah,
that's an
yeah, of
interesting
course, of
question.
course. Yeah. So what's a colostomy bag?
Yeah.
Colostomy bag is installed in patients who have bowel obstructions in their colon. Okay. Example, if you have a tumor, rectum, or the second defecate, they would have to cut your bowel, your intestine, your colon, cut your colon. Okay. Then install a bag. They install a colostomy bag. Okay, so that's a colostomy bag basically. So all your stool would be collected in that bag. And that bag you discard. Okay? You clean. All right? Now, cleansing plus is a fiber supplement. Okay? It's basically fiber. Then it is still a good idea for you to take cleansing plus even if you have a colostomy bag, because you still have a gut microbiota. Okay, so the gut microbiota would still benefit from any kind of fiber that you take in. But of course, if the question is, would I still have constipation if I have a colostomy bag? The answer would be no. Okay, there's no such thing as a constipation if I have a colostomy bag, because everything that the colostomy bag will collect would be in liquid form. Okay? Because there's no time for your colon to reabsorb all the water. Okay, so it would be in liquid form, but of course, no, you are getting the benefit the benefit that you're getting from the cleansing plus is that you are allowing or you are feeding your gut microbiota. Okay, and your gut microbiota would still form the necessary nutrients, the short chain fatty acids, etc. Okay, for you to benefit from it. Okay, yeah.
Wow, that's a very interesting question. I think that's the first time that question is asked in four years. So thank you for the viewer for asking that question. And I hope the rest of us get some insight. So again, as Dr. Jansen says, it's feeding the microbiome in your gut. I think that's really important. Doc, I think our viewers might really love a special session where you discuss why is the gut important for the immune system? It's like a whole different, because we always think bone marrow only, right? But to my surprise, the mechanism of how our immune system is matured is not just the bone marrow, it includes the gut system, and that's just amazing. Yeah, so thank you, Doc.
Well, spoiler alert, that's actually our topic for next week. So,
Oh, really?
yes.
Okay, so we're in sync. All right. I didn't know that. All right. So wonderful.
Okay, more questions about Cleansing Plus from Connie. Is Cleansing Plus only for losing weight?
No, not really. No. Okay, the benefits that you get cleansing plus would be the same benefits that you get from increasing your fiber intake. Okay? But of course, cleansing plus is made from psyllium husk, so it's still different. The benefits that you get from it would still be different than you eating real food, okay, real plant foods wherein you get different kinds of fiber. Okay? So you have to remember that because cleansing plus, the type of fiber it has is psyllium husk. Okay, so psyllium husk would increase your fiber intake. It will bulk up your stool. It would resolve constipation effectively. Okay, it's immediate relief. All right. So you get one kind of benefit from there, but another one when it comes to weight loss. Remember the drugs, the famous drugs that we have for weight loss right now, like your Ozempic, your Saxenda. Yeah, so these are GLP-1 agonists. Okay, so they mimic the effect of GLP-1.
What's that?
GLP-1 is a peptide. No? It's a protein that our gut releases to make us to stimulate the satiety centers of our brain. Satiety. It gives us the sensation of satiety. Although it is not okay. GLP-1 is a protein that will stimulate the release of leptin. Leptin is the hormone that makes us feel full. It will stimulate the production of leptin, basically. Okay, but it also has other effects, no, when it comes to blood sugar, when it comes to sugar metabolism. So going back, GLP-1, since it induces the satiety centers, it will give you the feeling of satiety for
Feels
very long
full.
period of time.
You'll
Yeah,
feel-
you'll
but
feel
you'll
full
feel
for a long
full.
period of time. So if you feel full, you won't eat.
Don't eat.
Yeah. So
You don't eat, you don't get fat.
yeah, if you don't eat, you don't get fat, right? Yeah, so that's the mechanism. Now, one way for you to avoid those medications, or if you can't afford those medications because those
Yeah, very
medications
expensive.
are very expensive, there's actually another so you have Ozempic, you have Saxenda, you have Wegovy. Wegovy is more expensive than Ozempic. Ozempic is a once a week injection. Saxenda is daily injections. Wegovy, I think, is monthly. But I can't remember correctly. I can't remember if I'm not that sure. No, but I think it's monthly or twice every week injections, no, or once every 2 week injection. Now going back, if you can't afford that, all you have to do is increase fiber intake, because fiber will also increase GLP-1. On top of the fiber acting like a sponge, soak up everything to make you feel full. Yeah, and it would also make your intestines slowly absorb the nutrients that you just ate. So example, you ate a cake. If you mix that with fiber, then the sugar inside the cake would be absorbed slowly instead of getting absorbed all at once, giving you blood sugar spikes and insulin spikes. Yeah. So other benefits of fiber is modulation of the immune system. If you feed your gut microbiota the correct food, which is prebiotics, which is also what Cleansing Plus is, psyllium husk is actually a prebiotic, then your gut microbiota would produce short-chain fatty acids to help with your immune system, to modulate the immune system. It will also help with your mood.
So there you go, right? So makes you feel good. Not only because you're slimming down, also makes you feel good from your hormonal balance in your body naturally. So again, it's very useful. Doc, I just came back from Chinese New Year, so I got a bit heaty, so my face is all red and flushed because of all the New Year goodies. By the way, I'm going to Taiwan, so if you want some theater, please let me know. I'll bring it back for you.
I'm good. I'm trying to lose weight myself, so
okay.
no temptations, please.
Yes, I
Thank
just
you,
signed
thank
all
you
my
for-
Chinese New Year goodies. I'm gonna give it to my staff. One pineapple thing is 200 over calories. It's
I know,
very
right?
scary, very scary. Okay, so when I came back to Philippines yesterday, first thing I did was take Cleansing Plus, because it really helps me move all these very high energy, very high calorie foods that actually build up, and it really makes you uncomfortable. Makes you like feel feverish kind of feeling when you eat too much of these like fried foods and all these goodies. So again, if you are going to Vikings and you ate too much, taking Cleansing Plus that night or the next day is a good way to help you overcome your sudden lack of discipline. All right, so that's another helpful way. And the last but not least, like I said just now, I was starting to feel feverish, and I ate so much nonsense that Doc, I have to confess, even my urine started to bubble a little bit. I'm like, okay, I think it's too much sugar and protein. So I really had to make sure I go to the CR, right? And that's how I use it. So that could be a useful tip for our viewers. Yeah. Jhen?
Yeah. Girls side, Valentine's Day is coming up, so the more chocolate you eat, the more Cleansing Plus you should take also. Okay, now this is a very interesting question about Cleansing Plus thrown to us privately. Does it also has deworming effect? Can it also kill parasites?
It
Since you're
cannot.
going to flush out.
Yeah, it cannot kill the parasites. I mean, the parasites might be happy that you're feeding them.
Yeah, so go and see a doctor and do a deworming, right? Yeah.
Yeah.
Okay, moving on to the next question from Sir Randy from Benguet. Welcome to the program po. Okay, his question is, I have tumor in the lungs. Upon knowing the situation, I used PPARS. I already consumed 2 jars of the powder, but now I'm using just the micro tablets. PPARS is helping me a lot. Okay, but my question is, why is my cough still persisting? Is there a specific PPARS form I should take?
Okay. The reason why the cough is still there is because the cancer is still there. So you have to go see your doctor, get checked up immediately. What are the other treatments that you're getting? So these questions have to be answered. Yeah. So if you're still coughing, then it's because of the tumor, because it's still there. So you have to be on cough suppressants. Okay, so some cough suppressants that you can buy over the counter would be Cinecod, Butamirate. Okay, that would be your Cinecod. Levopron as well. I just don't know if the pharmacy will sell you Levopron. Yeah, so those are some that you have to take. But if the pharmacy is asking you for a prescription and you cannot immediately see a doctor to get a prescription, no, then you might consider Lagundi, but Lagundi won't be able to do much. Might help, but not much, no. So those are the considerations that we have to consider, and that tablets is not enough to. Okay, if the goal is to make the tumor go away or shrink the tumor, the tablets is not enough. You have to be on the liquid, okay, especially for lung cancer.
Yeah. So yeah, I'm also surprised just now when you mentioned that you are on the tablets. Tablets is more for maintenance. When you're already doing well, when you're already in remission, as long as you still have the cancer tumors, it's always the powder and the liquid. Now, if you're going for chemotherapy and things like that, then the soft gel, just to help you, also to help you with the anti-cancer and also to help you manage your chemotherapy. So, of course, it's very possible that it might be for financial reasons, all right? It might be for financial reasons. So have a chat with our CSOs. At the very least, soft gel capsules, right? At the very least, soft gel capsules. So just the tablets alone is going to definitely help you, but it's not going to be able to help you become cancer-free. Right? It just then becomes one of the best nutritional supplements you can take to support your fight against cancer. Yeah. All right. So please, either that or go for consult with Dr. Jansen so that you can get greater clarity on how long more. What else can you do? So another way for those of us who have cancer is just a very expensive illness to fight. You know, that's just the truth. So Dr. Jansen can also give you advice on how to modify and improve your lifestyle so that you get the most out of your cancer treatments, be it PPAR protocols or even chemotherapy or other forms of natural integrative medicine, right? Because if you change your lifestyle, then you don't have to spend so much, or you can make the amount of money that you spend on your supplements more effective. Okay, so I would suggest that if finances is an issue, then you have to bring in lifestyle change and discipline, and that will mean that you have to spend less money because you're going to be healed faster. So in the end of the day, it will make your financial situation more realistic and more doable. Okay. So again, yeah, please go for a consult with Dr. Jansen to find out other ways you can take so that you can continue the good effects and the good results that you're having.
And if you're interested in PPARS capsule, watch until the end. We have a special exclusive promo for you po. Next question coming from Facebook from Emily Aliyong. Can PPAR powder shrink a 10-centimeter ovarian tumor?
Powder? Okay, this is my experience. Answer is no. Okay, it's not enough. You have to be on the liquid. And even with the liquid, 10 centimeters is very it's very large. So definitely, if I'm going to be your doctor, I won't just rely on PPARS liquid. I would utilize other things. okay, to try to shrink the mass. Another question is the mass malignant or benign? Okay, because for ovarian tumors, um it is one of the few tumors that even if it is benign, it can grow into huge sizes, as large as your basketball. Yeah, 30 centimeter size. Okay. We have had some success when it comes to ovarian tumors, no? Shrinking down ovarian tumors, use PPARS liquid. Okay. You want to know the patient? Just go to Simply Nature's YouTube channel. I think she's there. Name is Ciela. Yeah. So her case is an ovarian teratoma. Okay, immature teratoma, which eventually became a mature teratoma, grew in size. She was only on chemotherapy for a few sessions because she cannot tolerate chemotherapy. She had the surgery, but of course, there were tumors, no, left inside her because the doctors cannot remove everything because the tumor was really huge and it stuck to her other organs. Okay, so the few tumors, the residual tumors that was left inside her, Simply Nature PPARS liquid was able to shrink. Actually, there was one 12-centimeter tumor that completely disappeared. Yeah.
Wow, 12 centimeters. That's huge.
Yeah, that's huge. Yes, huge one.
Huge.
Yeah. Yeah. So, but just to make you, just to give you an idea on how long we handled her case, it was over a 2-year time period, time frame. 2 years. 2 years on PPARS liquid. Yeah.
Yeah. So again, as a few good points that Dr. Jansen says, right? If you have a huge tumor, 10 centimeters, 12 centimeters, even though as Simply Nature PPARS here, we're very happy that you're using our protocol. But as Dr. Jansen mentioned, you would want to combine other protocols so that you can, number one, shorten the time period that it will take to shrink. And that will affect how much you spend, right? The faster it is, the less you spend. Also, you also want to know that what's the right combination that will give you the effect. As Dr. Jansen mentioned, if you just want to shrink the tumor with one protocol only, then at the bare minimum, you must use the Simply Nature PPARS liquid, right? But perhaps if you consult Dr. Jansen, if there are other protocols you can combine with, you could probably use the powder. If I mean, use the liquid first, get the results, and you could probably go down to the powder. And with Dr. Jansen's monitoring and other protocols, you can maintain that good momentum. So again, thank you, Dr. Jansen, for that insight. And again, it's that the treatment of cancer is not just a single protocol, right? It includes lifestyle changes. It includes other procedures. It may choleric, all right, to make you feel more energized, but maybe not hyperbaric. Okay, vitamin C drips. These are all possible combinations. And of course, Dr. Jansen is also very familiar with chemotherapy, immunotherapy. So if you are choosing the conventional, he will also know what you can combine with. Okay, Simply Nature PPARS liquid and perhaps other forms of protocols, including drips, right? Okay, so again, thank you, Dr. Jansen, and thank you for that question for us to be able to remind everybody. Cancer is not one answer to that very tough puzzle. It includes all aspects from lifestyle changes to exercise to other palliative approaches that can improve your quality of life and, of course, the success rate of your fight against cancer. Jhen.
Couldn't agree more. More questions from Facebook about colon cleansing plus again. After colon surgery and has finished chemo, my husband still experienced hard to defecate. Will cleansing plus help him to have a smooth bowel movement?
Yes, definitely. The answer is yes. Okay. Yeah.
Solid answer, yes. Okay. Next question from Bing Soriano. Can I
Soft gel capsule. Yeah, me when I have okay, once every quarter I take a jar of the powder. The reason is because I'm 51 years old this year. I'm aging, and We just want to age well, all right? Just want to age well. So I actually have a client who takes Simply Nature PPAR liquid, like some people take Red Bull. She takes it for energy. Okay, so the effectiveness of the product is overwhelming. The only limitations is definitely because of the cost. We usually only take the extracts, the powder and the liquid, for therapeutic reasons. Okay, but for maintenance, yeah. But if you are like one of my clients where money is not an issue, you can take the Simply Nature PPAR liquid, even like a Red Bull. Okay, it's very effective, and of course, it's very effective for managing, how should we say, all the metabolic syndromes. Oh, I do have a vet. He's a vet, and he has, if I'm not wrong, I can't remember, is it prostate, colon, or lung? But it's one of the, of course, the ones, the scare that is common among men. He takes our soft gel capsules. He really takes our soft gel capsules. He also is, of course, overweight. So he takes it for metabolic, to manage his metabolic syndromes as well. Okay, so that's one. I think it's lung. I think it's lung.
I think it's both lung and colon.
You know which one, right, Dr. Alvin? I think
Yes,
it's
in the
yeah.
YouTube.
You go there, take a look at our YouTube channel. You can find his story over there.
Okay. Before we move on to the next question, let me greet one of our new viewers, Miss Carmen Calandria from Barugo, Leyte. Okay, welcome po. And the next question, from Facebook, Miss Liza Eleria. I have a goiter 9 centimeters already. What can you recommend?
Oh my gosh, it's huge. Okay, I'll share with you the experience of one of my patients. Okay, this patient of mine came in with a 11 centimeter goiter. 11 goiter
Imagine
on
already.
her right neck. Now, what I gave the patient was PPARS liquid. I placed her on high dose intravenous vitamin C every single week. Then after a few months, when we saw that the tumor was responding, so from 11 centimeter, it went down to 8 centimeter.
Oh.
When it went down there, no, I saw that she has plenty of enlarged lymph nodes as well. So with this characteristic, began to think that this might be something like cancerous, because the patient did not had a biopsy. So I don't know if it is, a benign mass or it was really cancer. So I don't know this. Now, upon seeing that it reduced and with the enlarged lymph nodes, I began to give her other medications like ivermectin, mebendazole, metformin, atorvastatin, aspirin. Okay. When I gave her this, she had a repeat scan. From 8 centimeter, it went down to 5 centimeters. But she still have enlarged lymph nodes. So when you take a look at her neck is seemingly normal already. You can have a glimpse of a normal straight neck, but there are a lot of nodules, still a lot of nodules. So these are still enlarged lymph nodes. So we're still in the period of treating, so we're still carrying on. And just to give you a time frame, more or less how long it took, from 11 centimeter down to 5 centimeter, it took 9 months. Yeah.
Wow.
But the fact is, it shrank.
Wow. Without surgery.
Yeah, without surgery, without chemotherapy, without the conventional thing. So just with what I gave her. She's very happy. Yeah.
No, we have a patient, same, but this one is actually malignant cancer. It's, I think, lymphatic lymph node, right? So it's huge here. This one shrank down with 1 box of liquid. Didn't completely disappear, but I think it was bigger. It's around 11 centimeters or more. It's really huge. It really did shrink down to like a mumps. She looks like she has mumps, but there's a big difference from a huge goiter to mumps, right? But for her case, it was really malignant. Sometimes I find that malignant growths shrink faster than non-malignant growths when it comes to using PPARS as a protocol. It's kind of interesting. Maybe the body deals with non-malignant tumors less aggressively. I don't know the mechanism, but I do find that it's interesting to note that non-malignant growths often shrink slower than a cancer tumor. Yeah.
Interesting. Okay. Next question from Vito Del Valle. What's the PPARS form for CKD stage 5?
Okay, CKD stage 5 is kidney failure already. So if you're on kidney failure, it's a choice between the tablets, the powder, and the liquid. Okay? But depending on your case, I would usually start with the tablets first. See how you respond, then add in the powder. So aside from PPARS, what else can we do? Vitamin C drip, that's one, low dose vitamin C. Another one is chelation. Another one is EBU, extracorporeal blood oxygenation and ozonation. If you will only choose one, I will choose EBU. Okay, extracorporeal blood oxygenation and ozonation, because it really cleans out the blood. It can even actually, in fact, try to lower creatinine levels. But of course, not improve kidney function. No, if you have CKD stage 5, then that's it. No, that's the kidney function you have. So you would have you would need regular treatments. But inflammation is very, very important.
How often the EBU? How often the EBU?
EBU, once a week it can be done once a week or once every 2 weeks.
Okay.
Yeah, especially for CKD stage 5. But for me, I would probably begin once every 2 weeks first, then see how the patient is responding. If we see some improvements, then push it to once every week, not more than once every week. Yeah, so that's the most. Going back, inflammation is very important, so PPARS would help with the inflammation. And of course, feed your gut microbiota, please. Okay, so PPARS it's a microalgae. Microalgae are also prebiotics. Okay, it also is consumed by your gut microbiota. All right.
I want to have encouragement for this particular patient, because sometime last year, because we are exploring working with the Association of Dialysis Centers. Okay, so we'll be introducing PPAR protocols to dialysis patients. So stage 5 kidney failure, CKD, that's basically your option now. Now I want to encourage you, because normally when a patient go on dialysis, it does affect their lifespan. Many patients' lifespan gets cut very dramatically once they go on dialysis. So one good news is, when I was in Taiwan last year, I was speaking about this issue, and there is a patient in Taiwan that has been on dialysis for 30 years. 30, that's a long time, right? So I think he got his kidney failure in his late 30s, early 40s. So he's really lived until like 70 years old, doing dialysis every week, right? And he actually eats relatively normally. So according to the general manager of our factory and farm, he actually eats normally. So he's not like on a special diet. Please don't do that. Please don't do that. Dr. Jansen will be upset with me for saying that you can. No, please don't do it. But I'm just sharing with you, because I think maybe now at his age, enjoying life a little bit, he eats normally and everything is okay. He's been eating PPAR tablets for the last 30 years. So to our viewers out there, this was probably something very new to you also, to know that the tablets have been around for more than 30 years. So this is something very established. That's why we're so confident about no contraindications, that it's safe to eat, that you can eat every day. It's great for your kids, great for you, great for your mom and dad who are in their elderly stages in life. So because the product has really been around for so long, right? Even older than the company Simply Nature, right? So we were founded, and then we now distribute here in Asia, right? So okay, so that's it. I hope that encourages you that the tablets itself help this person on dialysis for 30 years to have great quality of life. He has the normal level of energies. He's not like some dialysis patient, very tired and things like that. Okay, so yeah, there you go. And have a consult with Dr. Jansen so that you can explore the other modalities that he has talked about.
Okay, we're almost at the end of the webinar. This will be our last question for tonight, coming from Facebook comment, Ms. Josephine Abines. Is PPARS also respond well to spindle cell sarcoma on maxillary, undergo chemo and maxillectomy before? Had a nasopharyngeal 6 years ago before the maxillary spindle cell.
Yes, it will. But I think the case is quite complicated. Spindle cell sarcoma is also very, very rare. And this is on the maxillary area, so around at the jaw area. Okay. The question was not clear if the chemo is already done, everything done, or the
I
patient
think
still
everything
undergoing the
done
chemo.
because it said undergo chemo and maxillectomy before.
Had 6 years ago. Yeah, definitely. But I have to see the patient. Yeah, to answer definitively. But if you want to try PPARS immediately, go for the liquid and the tablets, no, immediately, especially if there's an active tumor or if there's a recurrence. Yeah.
Yep. Dr. Jansen gave the best advice. Go for the liquid because obviously this is a deep concern. So start with the best option so that you will have assurance of mind that, and then you took the strongest action that you could take to position yourself for any situation.
All right. It looks like we've covered all our questions. So as we wrap up this evening, we'd love to hear your final thoughts for our viewers.
Yeah, I'll go first, no. I want to close this tonight's webinar with in relation to the last question we had, no. So we are beginning to see a lot of cancers nowadays. Just looking at the top 10 causes of death of the Philippines and comparing that to 5 years ago. 5 years ago, the top one, ischemic heart disease. It still is now. Number two before was stroke. Nowadays, it's cancer. Cancer is already number two. So the number of cancer deaths in relation to heart disease deaths is still far when it comes to the Philippines. But I have seen countries wherein cancer is killing more people than heart disease. Okay?
Wow!
Very easy to find out. Just ask Google. Anyway, everybody's on Google, so very easy to research and search and to find out, right? Especially with AI nowadays. So this is very alarming. Okay, and we are beginning to see also a lot of young people who develop cancer, 30s, 40s, and when we have these kinds of situations, then expect recurrence rates also to go up. Recurrence rates in terms of how common recurrence rates will be. So very similar to what Miss Josephine's experience was, no. So this is a concern because another alarming thing is that the question of Miss Josephine is that the patient underwent chemo and surgery, and yet it came back. So how is it so? No, wherein we did everything we could, but still cancer comes back with a vengeance. Okay, so definitely there has to be some things more than the usual chemotherapy, the usual surgery, the usual radiation therapy, the immunotherapy targeted therapy that we're doing. Some things have to be done with the patient in addition to these protocols, no, in order to get the best outcomes. So that would be my role. Okay. So if you need any help, so just message the staff or message the page, no, to schedule an appointment, and I'll do my best to help you. Okay. I'll do my best, but of course, please understand. Please don't come to me when you are very, very worse already, because I'm not Jesus Christ. Okay.
Yeah,
So anyway,
I just have to say, be fair to Doc Johnson and really be fair to, yeah, you don't, a lot of times patients see oncos or something, and then their condition got worse, and then by the time they come to you, very little to work with, very difficult. But still, go and see Doc Johnson, because he done amazing, help patients who are in very terrible conditions have amazing results.
yeah. And lastly, in relation to that, no, something that we integrative oncos and conventional oncos agree on. Okay, this is something that we agree on, is if we treat the patient early in the disease, early stage cancers, then the chances, the prognosis is better compared to when we're treating stage 4, and not just stage 4, a lot of complications. Oh my gosh. Like non-healing wounds on the breast, ulcerated wounds. Oh my goodness. Okay, really, really bad. So anyway, I hope this webinar gave you some hope, and you learned some things, some new things. Okay. So thank you everyone for listening. I'll give the floor to Sir Shyan.
Thank you, Doc. Just as what Doc has shared, the cancer rates are going up, and of course, with that, we're going to see also recurrence. I think this has got a lot to do with our lifestyle, right? Everything that we eat on a daily basis. So to all our viewers tonight, what are you taking to help yourself on a daily basis? So I'm not just talking to the cancer patients listening to us tonight. I'm talking to the rest of us, right? Those of us who do not have cancer, based on the statistics that we see, if we do nothing, there's a high chance that we will develop cancer at some point of our life. So we know that we, in our daily lives, we do many things that contribute to us developing cancer. The good news is you can also do many things to combat the onset of cancer so that you don't have cancer in your lifetime. And I would advise, when it comes to supplement, no basic supplement better for anti-cancer than Simply Nature PPAR tablets. You have seen that cancer patients take the Simply Nature PPAR tablets to fight cancer, to do well. Now, it also works as a way to prevent, because it deals with all the factors that contribute to developing cancer, including your metabolic syndromes, your comorbidities, your inflammation. These are the important things. So do remember, it's not just about vitamin C. All right. And for those of you who take supplements because you want to look good, here's the good news. All right. Simply Nature PPAR tablets actually stimulates the natural production of glutathione. So those of you who want to look fairer, and it's rich in PPAR. It has PPAR agonist, so that it stimulates cell delineation. That means that it helps you to have better skin. So all the ladies, if you take Simply Nature PPAR tablets for more than 2 months, you'll notice when you're washing your face or in the shower, your skin feels a lot smoother, your foundation goes on much better, okay? For guys, you probably never notice any of that because we don't notice things like that, but it happens, okay? So for me, I take Simply Nature PPAR tablets for longevity, for anti-aging, okay? So with all that, things are, yeah, I'm surprised by the news that cancer now kills, is the second killer. And in some countries, it actually kills people more than cardiovascular diseases. That's a surprise, but we can do something about it. So again, we're just only in the second month of the year. So look forward to many more interesting sessions like tonight, where tonight's questions, Jhen, were really quite new. A lot of basic class today, right? And so we enjoy, and see you guys next week. I'll hand the time back to Jhen as she closes tonight's program.
Thank you so much to our experts, Mr. Shyan and Doc Jansen, for sharing their expertise and insights. If you have any follow-up questions, don't worry, we will answer each of them next webinar or via direct message. And if you or a loved one are battling lung cancer or any type of cancer or any health issue at all. Remember, science is evolving and new treatments are emerging all the time. So keep informed and explore all available options. So don't forget to like our Facebook page and subscribe to our YouTube channel. Also check out our website, that's www.simplynature.asia, for exclusive promos such as number 1, get more than 280 pesos off when you buy either PPARS powder extract or PPARS liquid extract. Number 2, get a free bottle of PPARS tablet when you buy 3 boxes of PPARS liquid extract. And lastly, get 1 pack of soft gel capsules when you buy 6 packs. So we hope to see you again in our future webinars to come. Same day, same time, every Thursday night at 7:30 p.m. Next week, February 13, we'll talk about why the gut matters and ways to improve your gut health. So thank you once again for watching Simply Nature webinar powered by SMG or Simply Healed Medical Group, because your curiosity about your health condition and your victory over cancer and metabolic diseases is what keeps us going. Here in Simply Nature, we're always with you from start to healing.